Doctor, will you please lead the timeout?
Scalpel.
No, really, we need to do a timeout first.
No, really, you don't understand. You have already delayed me. I am in a hurry, and I have patients to see. Scalpel.
Timeout! We can't start surgery until we call a timeout. Just like football, the players take timeouts to huddle and agree on plays. To deliver the safest patient care, we must do the same. We must verify the correct patient, procedure, and site before we make the incision. Remember, we are the patient's advocates. There's no I in team. So let's do this thing.
Go
team! Doctor, will you please lead the timeout?
You don't need a timeout. You know what you're doing.
Let's keep the patient safe.
You're the surgeon, for goodness sake. This is a waste of your time.
It takes less than a minute. Let's keep the patient safe.
You're the one that marked the spot. Why do you need to verify it?
Even the best surgeons get tired and make mistakes. Don't let this be your first.
Just give her the knife.
Patient safety is your #1 priority.
She's gonna yell at you.
Do the right thing for the patient. Who cares if she yells?
You don't make enough for this.
Did you really get into this for the pay? Do the right thing and keep the patient safe.
You know, I just thought about it. Let's do a timeout.
That's a great idea, Doctor.
According to AORN 2013 Perioperative Standards and Recommended Practices, the following standard information is to be addressed during the timeout, which begins after the patient is prepped and draped. Correct patient identity. Correct side and site are marked. Consent is present and accurate, and procedure is verified. Confirm antibiotics have been administered. Confirm the skin prep has dried. Correct patient position. Confirm images and results are labeled and displayed. Any other applicable information the team should be aware of, such as allergies, fire risk assessments, prosthesis, blood products, or special equipment. At Barnes-Jewish West County Hospital, we have taken the timeout a step further to ensure patient safety. Our universal protocol policy states, the timeout is initiated verbally by the surgeon after the drapes are placed. All team members are to stop all activities, look to visualize the site marking, listen, and participate in the timeout process. Timeout procedures in the operating room have been extended even further. Drapes do not cover the site marking. Staff breaks cannot occur between patient interview and incision. The circulator completing the patient interview will not be relieved for break until the timeout is performed, and no scalpels are to be placed on the Mayo stand until after the timeout is completed. And now for an official timeout.
Howdy! I'm just so proud to be here. Who wants to do a timeout now? We're saving lives. Put down those knives. Who wants to do a timeout now? Listen, everyone. Correct patient, correct side, correct procedure, left or right. Who wants to do a timeout now? Everyone agree. Glenn, are you in timeout again?
Maybe.
Not what I had in mind.
And now, the official timeout, take 2.
Let's do the timeout. This is Jane Doe. We're doing a right total knee replacement. The site marking is visible after draping. Skin prep is dry. Were antibiotics given?
Yes, NSAID 2 grams was given at room time.
Patient is supine. X-rays are hanging. Implants in the rep are here and ready. 2 units of bank blood are in the refrigerator.
Does everyone agree?
Agree.
Agree.
Timeouts are an international standard of care. They prevent wrong site surgery, they ensure the quality and safety of our patients, and they ensure that we can deliver the best possible care here at Barnes West Hospital. We hope that you'll participate enthusiastically in the timeout process. Thank you.
I do a timeout to ensure the correct patient and procedure are identified.
I do a timeout to ensure the correct side and site are identified.
I do a timeout to ensure the marking is visible on the draped field.
I do a timeout to ensure the correct pre-op meds and antibiotics are given.
I do a timeout to ensure that the patient stays safe and injury-free.
Safety is critical, first and foremost for my patients, but also for institutional reputation and success. A timeout prior to every surgical procedure establishes unity in the surgical team in the form of a collective statement of commitment to our patient's safety. This is the intelligent and responsible way to provide health care. And remember, resistance is futile. Now, get this. 2 little mice fell into a bucket of cream. The first mouse quickly gave up and drowned. The second mouse wouldn't quit. He struggled so hard that eventually he churned that cream into butter and crawled out. My fellow healthcare workers, as of this moment, we are that second mouse. Superstar!